People suffering from dementia don't only have to deal with psychiatric problems, they're also more likely to be sent to hospital for injuries or infections. And new research has found that while they're there, they fare much worse than other patients. For many with dementia, a hospital stay can be a setback from which they never recover.
When the Royal Hobart Hospital opened a ward specifically for dementia patients last year, it was lauded for taking such an innovative step. By 2050, 1 million Australians are expected to be diagnosed with dementia, and it's people who suffer from the disease that are more likely to end up in hospital for infections or injuries.
Fracturing their hips, having head injuries, other wounds as well. And this is because they lose their balance, they're not quite as stable on their feet.
A new report says once dementia patients are in hospital, their prospects aren't good. They suffer more complications and infections than other patients, and they tend to stay there longer. Dementia patients are more likely to die in hospital, and even those who don't never fully recover.
Of course, if you're already feeling unwell, you're in a strange environment in a hospital, don't know the people around you, don't know the way in which the place is organised and noisy, it increases confusion considerably.
Dementia patients are also more likely to be transferred directly to nursing homes. Alzheimer's Australia says services need to be put in place so that ill dementia patients can be treated in their own homes. But since some will need to go to hospital, there are calls to make hospitals safer for them.
It would mean having trained staff, it would mean having systems that recognise people with dementia, it would mean having specialists.
He's calling for a boost in government funding for research to improve treatment and better educate healthcare professionals. Meredith Griffiths, ABC News.